Raghavendra sir and for organizing and giving me this opportunity to address the gathering. And thank you once again, everyone, all the organizers. And I'm sharing the slide now. Yeah, is my slide visible, Anand sir?
Yes, sir, it is visible, sir.
Okay, okay. So it's changing, right?
Yes, sir, it's changing.
Yeah, thank you. Thank you so much. So, as we all are gathered here to remark the day of World Alzheimer's Day, that is actually launched on September 21, but worldwide it is celebrated as Alzheimer's Month. So during that month, there are several activities which are planned worldwide. And today, one of the evidence of that is the webinar which we are conducting right now here. So I bring warm greetings from my college, behalf of Dean Madam and all my colleagues and myself from Bharati Vidyapith Deemed to be University, College of Nursing, Sangli, Maharashtra. So today we are going to discuss about what is the worth of celebrating this month of Alzheimer's Disease Month, and what are the things which are related or associated with the theme of current year, which is I'm going to just unveil next slide. And the outline of my today's discussion would be like it's about the timeline of World Alzheimer's Day campaign, then facts about our brain, then old age signs and symptoms and brain changes in old age. Okay, and then difference between normal aging and dementia, and then I'm going to throw a light upon Alzheimer's disease, which is the facts and related aspects of Alzheimer's disease. And then I'm going to discuss with you a very interesting fact, that is the difference between Alzheimer's disease and dementia. So management of Alzheimer's disease related dementia, then preventive care, and what is our role in doing this care or management, and tips for communicating with Alzheimer's patients, how the approach should be, and what are the recommendations which we can put forth in order to enhance the activities related to management of Alzheimer's disease. So if you see the chronicle or a timeline of World Alzheimer's Disease Campaign, which is basically to say, actually in 1901, the German psychiatrist called Alois Alzheimer, who identified the first time the case of the disease within the patient, like 50 years patient, German woman who was suffering with some sort of psychiatric symptoms. At that time, it was known as a psychiatric disease. So those after the death of that woman whom the Alzheimer was treating, then he could see that when he opened the brain and he saw the brain of that woman, he could see that there are certain brain changes which are very much evident, and repeatedly when he observed such patients in future, and he termed that as Alzheimer's disease. And the Alzheimer's disease is named after his invention, that is Alois Alzheimer. And later in 1994, World Alzheimer's Day was introduced by Alzheimer's Disease International Association. Alzheimer's Disease International Association was in fact established in the year 1984, but on marking the 10th anniversary of Alzheimer's Disease International Association in 1994, September 21 at Edinburgh, UK, in the annual conference, they announced the Alzheimer's Day has to be celebrated every year in order to sensitize the public and sensitize the stakeholders in order to take up the Alzheimer's disease as a challenge and to minimize the burden which it causes. So that was decided in 1994, and the first Alzheimer's report was released in 2009, and then Alzheimer's Month as a celebration marking the World Alzheimer's Day as a Alzheimer's Month, which took place in the year 2012. Then if we have to see the further depth of that, the first theme of World Alzheimer's Month was in 2012 was Dementia, It's Time for Action, which was focused on applying the pressure to governments, authorities and stakeholders to evaluate the current policies around dementia, also to improve service for people with dementia and their families, which was lacking in a very dead rate situation the dementic patients were. So the dementia, it's time for action. That was the call of action, which was initially announced in the year 2012. Why this World Alzheimer's Day or Alzheimer's Month is important for all of us as a right from general public to means the beneficiaries to the care providers. What it does is it's very significant event in the world which has to be taken place every corner of the nation where because it brings people together. It provides valuable education or updated information related to the Alzheimer's disease and its consequences. And then recognition for Alzheimer's organizations can come into limelight. Like, for example, you might have not heard before, but the Indian Association is also present, which is working for Alzheimer's disease and the patients who are suffering with dementia and Alzheimer's disease related issues. That is named as Alzheimer's Related Disease Association of India. Alzheimer's Related Disease Association of India. Okay, that is working for the people of suffering from dementia and Alzheimer's disease. So on this special day or unique month, the world concentrates its effort on creating awareness of Alzheimer's disease and its facts and figures. So if we have to focus on this year theme, the theme which is given by ADI, World Alzheimer's International Association, which has proposed the theme for this year, that is no dementia, no Alzheimer's. Okay, and the sub point of that no dementia, no Alzheimer's is to post diagnosis. Especially, we have to understand the dementia and the Alzheimer's post diagnosis. The current focus for this year is knowing the dementia, knowing the Alzheimer's disease post diagnosis. So if you have to throw light upon the previous year's themes, like in 2021, the theme was again no dementia, no Alzheimer's, a timely diagnosis. So last year was identifying the early case and diagnosing it was the focus. But this year, the focus is upon much more upon the care of the patient who are diagnosed with a dementia related to Alzheimer's disease. And then in 2020, the theme was to remove the stigma and to propagate the facts and figures, scientific facts and figures to the public and to the care providers. That the theme laid down was, let's talk about dementia. Okay, and then in 2019, also the theme projected, let's talk about dementia, which wanted to emphasize that Alzheimer's Disease International, which wanted to emphasize the conversations have a power to break the stigma. Okay, and then 2018, the theme, unique theme which was proposed by ADI was every 3 seconds someone suffers from dementia. So that was the theme in 2018. These all themes are emphasizing upon highlighting the huge global impact which is observed with the dementia and Alzheimer's disease, which is causing a burden or the disability which is bringing into the individual, and that is really a debilitating situation for the family, community and nation and the world as such. So to mark this and to create the awareness and to identify the cases and provide the proper treatment and channelize the campaign, the ADI is framing the theme for every year to work upon the dementia and Alzheimer's disease. So before going into the depth of knowing the dementia and Alzheimer's disease, okay, let me discuss some facts of our brain. Okay, as you all are aware, like anatomically, our brain approximately weighs around 1.2 to 1.3 kg, which varies again with the gender. Especially in the men, it is little heavier, that is about 1.339 kg, and whereas in the woman, it is about 1.228 kilogram. but it's very tiny or very small organ which is situated in the head. Okay, but it's very important organ in the body which plays a major role. And if you see, it's a small organ, but it receives overall the 30% of the blood which is pumped from the heart is supplied to the brain. Okay, and it only weighs around 3% of our body weight, and but the 30% of the blood is supplied out of the pumped blood out of the heart is supplied to the brain. And it has got a tremendous amount of capacity to store the information, to recall, and to utilize the information which is gathered. Okay, that you can see around it is estimated that around 2.5 petabytes, that is 1024 GB into 2.5. So it is like endless, we can say. And when the individual is awake, your brain produces enough electricity to power a small light bulb. So that much is the capacity of electric impulses which are working within the brain. And suppose if the information from the lower extremity or upper extremity, which is reaching through the connecting neurons to the brain, the information going from the extremities to the brain, which travels at the speed of 150 miles per hour, that is equivalent to the speed of Bradley or Shoaib Akhtar, which they ball around 150 miles per hour. Then one more fact which is very interesting to know all of you, that is the brain is the fattiest organ in our body. Okay, which is rich in healthy fats such as omega fatty acids. Okay, which consist of minimum of 60% of the fat. Whatever the weight of the brain is there, like 60% of that weight is constitutes the fat. So most like majority part of the brain is fatty omega-3 fatty acids or omega-6 fatty acids, which is composed of, which the fat covers the brain, which is specially to protect, to maintain the gelatinous of the brain and things so on, so on. So it as you all aware that how the brain is connected with the mind, or what is the biological functions which takes place in the brain, which controls or which regulates the behavior, and which we can do right from the small tiny work to the major task. And we can do that right if the evidences are right in front of us. Like there are many inventions, many advancements which are taking place. That is all through the help of brains, which are involved in creating such wonders in the world. So brain is a very powerful organ in the body, and which is very much like important aspect of any person's activity or the life. But at a time, what happens is, as we get like as we grow and we age, okay, and after 40 years, the degenerative changes which starts taking place in the human body, which usually starts after 40 years, and which is very significantly observed after 50 or 55 years. So the relative changes which takes place in the body are like all the systems starts collapsing or start functioning in a minimal way, or the optimal functioning will start declining in their power or capacity. And then that proper age or that particular period is called as old age. So old age is nothing but aging, and aging is what? Aging in other terms, what we can understand is aging is a benign senile forgetfulness. Senile is nothing but the old age. Forgetfulness is like individual tends to have the simple lapses in the memory, that too especially the recent and remote memory, which the lapses in the memory can be seen due to the degenerative changes which takes place in the brain and the fundamental units of the brain, that is neurons. Okay, so we are going to see later on what changes occur in the case of old age, and what are the changes which exactly take place in the case of Alzheimer's disease, which leads to dementia. So there are significant changes in the brain which takes place once the individual attains the old age. So the significant changes includes the particularly the size and volume or the weight of the brain, which usually declines at 5% at the 50 years of age. And as the age increases, the percentage of decline in the volume or weight of the brain goes higher and higher. That is 7% after 70 years. Okay, and then there is another significant loss which takes place in the brain is loss of gray matter, especially in the prefrontal cortex of the brain. And the least affected area of loss of gray matter is occipital cortex, which is least affected. Then there are the specific changes which are observed in the brain, that is like neuronal volume. Okay, the number of the size of the neurons are also declining. So as a whole, as the neuron size are decreasing, as a whole, the brain size also gets shrunken. Then the some biochemical changes which takes place as a normal old age changes are like dopamine and serotonin levels in the brain decline. Okay, and by around 10% per decade associated with decline in the cognitive and motor performances, which are evident with the lack of dopamine and serotonin neurochemicals in the brain. The cognitive and motor or psychomotor performance gets declined. So again, the other one increases, that is monoamine oxidase, the enzyme which increases in the brain. Okay, as the individual gets aged, or as the advancement in the age occurs, the MAOs or monoamine oxidase increases, which helps in the which removes when the actual function or normal function of monoamine oxidase enzyme is to destroy the norepinephrine, serotonin, and dopamine in the brain. Usually, normally it functions, but as in the monoamine oxidase are increasing, so the excess of destruction or destruction of norepinephrine and serotonin and dopamine which takes place in the brain, and subsequently whatever the normal amount of these neurochemicals are which are necessary for the individual to function properly, those will lack. So hence the cognitive declinement and the motor performances are changed, okay, or retarded. Then there are certain signs and symptoms to understand what changes which are seen in terms of symptoms in the old age. That forgetting is the one of the hallmark of old age. Okay, but here the person is not totally forgetting. Okay, as we are going to see in the difference between the dementia and the old age. So here the simple forgetfulness for a while, but he can recall it later, and not finding the right word to express while communicating. He struggles to find the words actually, and then taking more time to learn the new things. Okay, which the individual is unable to learn the new things which are simple also to learn, but they are unable to do so. Then taking longer time to react or respond to the cues or the stimulus which is coming towards them. So such declinement or the negative symptoms which we can see there in the old age people as the age advances. Okay, the people who are aged above 55 years of age. These symptoms are okay for some extent, but when they worsen at a level where it interferes into their activities of daily living and it interferes into their daily affairs or interactions, then it is abnormal, and that can be termed as means that is worrisome case or the condition which can be thought as the Alzheimer's and dementia. So because what happens, the individual, when he has these simple problems, that simple problems create anxiety and frustration within himself, and those tends to worsen. This normal forgetfulness, not finding the right word, or not properly able to interact, or not able to comprehend the simple task which is in hand. So all this will create fear and anxiety in them, and that frustration leads to the more again worsening of these signs and symptoms, and that may take a toll of an individual as dementia. So what is dementia now? As we were discussing, or we were seeing old age and dementia. So what is dementia? It's a bunch of symptoms. Okay, dementia is not called as a disease. It's not a disease. It's a bunch of symptoms. So at a time we can call it as a syndrome. Okay, or a bunch of symptoms which come together, and that leads to the organic changes, which leads to the change in the behavior, okay, or the psychomotor activities which are abnormal in nature. So that is the nature of dementia. Dementia means that there is something wrong with the person's brain. So that is an organic base is found to see the disruption in the behavior and the psychomotor activity of the person with dementia. And there are several causes for dementia, which rightly includes from the age. Age is the one risk factor, and the biological causes such as some kind of brain injury or brain disease. Okay, brain diseases are many. Okay, the infections and things like that. And even the COVID has also shown that the virus can enter into the brain and that can damage the neurons. So COVID-19 or the communicable diseases, and even the some of the cardiac conditions which pumps less blood to the brain. Okay, the 30% of the total pump blood has to be reached to the brain, which is not sufficient. Then it leads to the lack of blood supply, and that related to that the changes can be seen in the neurons. And those who are chronic drug abusers or alcohol abusers, and then the deficiency, severe deficiency of certain vitamins and like certain vitamins and the very much essential micronutrients which are lacking in the individual, that leads to the dementia. And the hormonal imbalances, particularly the hormones such as the adrenal gland hormones and the such the thyroid hormones and things like. So hormonal changes also, abnormality in the hormonal balance in the body also can lead to dementia. And as it is very commonly known that it is associated with the old age, and most common symptoms of dementia includes like confusion and memory loss, okay, and gross changes in the personality. And there are at a time we can see the irritation in the patient due to the mood, and the mood swings can be seen. They're fine at some time and they get worsen at other time. So confusion is very much evident in those dementing patients. Then speech problem, as they are not getting the word to express something, okay, or they are confused what they are explaining or what they are talking about. So there is speech problems which can be seen in them, and there is a general difficulty in carrying on with the day-to-day activities. So grossly it affects the day-to-day activities or activities of daily living, okay, and the daily current affairs which the individual is interacting within the environment. So that are grossly affected, and when it is seen, then it's a very worse condition where the individual goes through at a time. Then the patient turns into like certain psychotic symptoms like delusion and hallucination. Due to confusion, they start believing on unrealistic thing, and which cannot be changed by the individual, as well as they may reproduce the hallucinatory behavior, such as like auditory hallucinations which direct their behavior, or the visual hallucinations most commonly seen in them. So some dementias can be reversible, okay, at a time, like some patients like some poisoning or drug, the effect of alcohol or the drug, and the vitamin deficiency or hormonal imbalances. Those the cause can be corrected so that it can be reversed. And most of the dementias are irreversible due to, like, if there are changes in the brain cells like neurons, neuronal changes which are destruction of the neurons which are evident, then in that case these dementias are irreversible. And to be frank, or to mind you, that 80 to 90% of all the dementias are irreversible in nature. Hardly 10 to 20% we can see that the dementias can be reversed back. They are just for temporary, but most of the dementia are irreversible. Because such irreversible dementias are accompanied with Alzheimer's changes or Alzheimer's disease, where the individual has got Alzheimer's disease, and then the dementing features or clinical features of dementia are evident. So in Alzheimer's disease, irreversible type of dementia, which can be also termed as or senile dementia, which is responsible for 60 to 80% of the dementia. Okay, and like just to orient you with something, like dementia is an umbrella term. Okay, it is an umbrella which includes many aspects. Okay, many things. Okay, and an umbrella term used to describe a range of symptoms associated with cognitive impairment. So those cognitive impairment in turn can be seen into the behavior and the personality changes and the activity related changes. And the causes, if we have to see, the cause of Alzheimer's, like Alzheimer's disease is the most frequent cause of this dementia. Okay, and 10 to 40%, as I mentioned you earlier, with the cardiac related conditions and reduced blood supply to the brain. Okay, and Lewy bodies like those like poison and like some drugs or alcohol consumption, that leads to 10 to 25% of dementias, and most nearly equivalent to 10% like frontotemporal region, like frontotemporal sideways and the frontal region of the brain gets most of the time involved with some head injury or so on, like that leads to dementia. And if you have to see one continuum which suggests about the mild cognitive impairment, MCI stands for mild cognitive impairment. And as we saw that in the old age changes or as a normal changes in the old age, mild cognitive impairments are very frequently seen. The continuum which is projecting towards the cognitive unimpairment and the severe dementia, you can see the journey of a person or the cognitive impairment which can get through the person as age advances. Okay, so impairment does not interfere with the activities of daily living until it is mild cognitive impairment or mild dementia. Also, sometimes it can undergo underdiagnosed or it cannot be evident to see the changes in the activities of daily living. But as the mild dementia worsens little bit and enters goes forward with the moderate and severe dementia, it severely affects the person's activities of daily living and it interferes in the individual's current affairs, or he cannot initiate any work, and it lot of mess which takes place in his mind, so that he's confused what to do and he cannot trust people. He cannot show off that he is having the forgetfulness and confusion like that. So he's not, it means that he is fit for nothing. It happens in such circumstances. So as we discussed with some symptoms of dementia earlier also, so again we can throw much information related to the symptoms of dementia. One thing is very clear here, that this dementia does not occur overnight unless it is poison, like the overconsumption of certain substances, okay, or exposure to the poisonous objects or the chemicals, okay, unless and until that cases are found. But usually dementia is very gradual. It takes around when we start seeing the symptoms, okay, it takes around 10 years to see the mild dementia as the age advances. Okay, once after 50 years it may appear at any time, but gradually it starts developing and it takes around 10 to 15 years to see the clear-cut symptoms. Okay, that is gradual and very slow progressive until they become problematic in the patient. So until it results into a problematic phase, where you can see here in mild dementia also for few years this cannot be identified, but after once it is identified, already this mild cognitive impairment has taken a toll and the individual has disrupted his daily functioning related to declinement in the cognitive function. So it takes very slow progress and it is gradual in nature, one by one or step by very slowly it accelerates its speed of development of symptoms of dementia. So very famous symptoms which can be seen are lack of concentration and focus upon the things which they are dealing with or they are working with. Okay, and then because of disappearance of memory, gradually the memory declines, especially the recent memory. They start forgetting the just now what they have done or last week what they have done. They even, you know, like sometime in a normal aging we can say when a person goes to watch a movie at theater, he may forget some things about the movie or he may forget the storyline of the movie, but he remembers that he had been to movie theater last week. But in dementia, what happens is they usually tend to say that I did not go to movie last week, where I did not go. So such statements can be observed in the individual with dementia due to lack of memory, or the impression of the memory are very faint, okay, which cannot be seen or which cannot be recalled by the individual at all. So they reject or they deny the incidences which have taken place around them in the last week. Then inability to recognize and use proper verbal and non-verbal cues. So they lack with the proper verbal because they're lacking the vocabulary or the words are not coming in on their tongue to express their feeling or opinion. Okay, as well as due to the neurochemical changes in the brain, changes in the neurons and the chemicals, that leads to the disturbances in the identification and expression of non-verbal cues also. Sometimes they are unable to say what conveys their with the facial expression or body movement or whatever, that also gets dysregulated. Even smile also. Okay, they cannot recognize the smile given by the other individual, opposite person. So, or they are unable to give a smile back to the person who is giving a smile on them. Okay, so such small but very simple task also that gets dysregulated. Then inability to understand the sound. So there is impairment in the hearing and in the old age, but here there is a loss of interest in listening to music and becoming a passive listener. Music is played somewhere, but they are not minding it. Okay, that because of lack of interest, which is mainly controlled by the neurotransmitter, which is dopamine and serotonin, which are involved in leading to create the interest, but they lose the interest due to such biological impairments. Then loss of senses, which are evident. Okay, then inability to understand and identify the problem, difficulty in differentiating the things. They cannot prioritize, they cannot classify, they cannot distinguish, or they cannot separate the things. Okay, so there is poor prioritizing and poor ability in differentiating. Okay, and then reduce the daily activity and mobility. Okay, that as it is seen. Okay, due to the excess breakdown of catecholamines. Okay, excess of catecholamines, or sorry, excess destruction of the catecholamines, which leads to the impairment in their muscle coordination. Okay, and then even after all these symptoms which are seen in them, okay, they start withdrawing themselves from the society. So they remain aloof themselves. They choose to be alone. They don't want to talk to anyone. They don't want to express their feeling and opinions or ideas, even though they are thinking to express. Okay, little social interaction and lack of personal hygiene is most of the time which they can be seen with. Then dementia symptoms like continuation of that, inappropriate action, that is they don't dress properly, they are unable to put the buttons of their shirt, okay, or they are not able to wear the dress properly. Okay, so such impairment in the actions can be seen, like minor activity also get impaired. Okay, then difficulty in learning new things, as it is very clear that like the registration of memory is impaired. So they are not understanding the clarity of the work in hand, task in hand. Hence, that leads to the difficulty in the registration of that activity, registration of that is a memory process, you know, like first thing is perception, then next stage is to register it and store it and retrieve it whenever it is necessary. That is a process of memory which takes place in a normal human being, but in them the registration is a problem. The prints or the imprints of the external stimuli are not properly drawn in the brain or in the mind. Hence, they are lacking to see or learn new things because they forget next moment. Then they have a tendency to suspect the activity of others. Because of confusion, what happens is they tend to, yeah, someone is unmute. Soumyadeep, please mute yourself. So there is a high tendency of the individual to suspect upon others because of lot of uncertainty and confusion, which is covering up masking the brain and the brain functioning or the mind. Okay, and then it leads to the development of some misunderstanding, and that misunderstanding leads to the paranoid behavior or the suspiciousness in the individual. So now we saw dementia and its symptoms, okay, and the nature of dementia. Now we'll have to just see what are the global impact of dementia. If we have to see the total expenditure which is done upon the care of dementia, which is happening in the all over the world, then the total amount which budget which is or the spent on the dementia, that itself becomes the 18th largest economy in the world. Okay, even if we see Google is like 38 million dollar, whereas this toll or the burden of dementia is So like it is much more than that, and it is the 18th, it can become 18th largest economy in the world. So that is the toll which takes place, or global impact which can occur. And the another astonishing fact which is seen is, as we earlier also understood, that one in every 3 seconds person suffers with dementia. He is diagnosed or he is developing a dementia related symptoms once in every 3 seconds. So you can imagine the magnitude of dementia which is increasing worldwide. Okay, if we see in 2015 it was just 46.8 million. 2030 it is projected to go around 74.7 million. And currently, if I have to say, currently about 68 million people are affected with a dementia, identified to be affected with a dementia as a syndrome or as a disorder. Then it is projected to go up to 131.5 million in year 2050. So if you have to see the impact of dementia on COVID-19 infection risk, there is high tendency, because like potential factors which are contributing to increase the vulnerability include comorbidities such as hypertension, diabetes, okay, forgetting to wash hands, social distancing, living in long-term care facilities which is overcrowded, or not following the social norms, okay, or the behaviors which are directed by the medical authorities of the country, which they are forgetting to. So every one instance of forgetfulness is enough to spoil and to get infection of COVID-19. So there is a high potentiality of developing COVID-19 among dementic patients, or otherwise the caregiver has to be behind them to take care of those social appropriate behavior in the individual. So, but they are highly vulnerable as they have the confusion and forgetfulness as a memory loss. So they may forget to wash their hand or apply the sanitizer or maintain the social distance. Okay, and that is having a high probability of developing COVID-19 in the dementia patients. Then risk of contracting COVID-19 was 2 times higher high for people in the study with dementia than those without it. Okay, so see that contracting of COVID-19 was 2 times higher in the dementia patient than compared to the non-dementia old age people. Okay, so it is 2 times higher than the normal old age people. Okay, and then researchers analyzed the health record data from almost 62 million American adults, and they found this identification or these findings. Okay, and the COVID-19 and dementia, which is another fact which is coming in front of us, is African Americans are close to suffer 3 times higher the risk of COVID-19 infection, okay, as compared to the white individuals in the America. Okay, in the United States, the African Americans are having high tendency of suffering. When the root cause of this, when we have to identify that their genetical makeup is such a way that they tend to do such behavior, okay, and they tend to develop more chances are there to develop COVID-19 among African Americans who are having dementia. So Alzheimer's disease related dementia, that is ADRD, Alzheimer's disease related dementia, what bothers our country? So there are certain facts and figures which are bothersome to the country like India as a developing nation, fastest growing economy in the world. Okay, here in India, persons aged 60 years and above is projected to be 19.1%, that is around 316 million, or approximately the size of current US population in the year 2050. So if we have to see now, currently we are propagating that India is a youth country. There are many youths than compared to the other nations in the world. But one time those youths are going to be old age also. So we have to be very careful, and we have to visualize the prospect which is in front of us to see what is going to be the situation of India after within 2050 or another 30 years or so. So it is projected that there are like 316 million people are going to be old age people in India. Okay, that is total population at that time, what it constitutes. Among them, nearly 20% of the population will be old aged. Okay, that the statistics given from United Nations Department of Population Division in 2017. Okay, and then the global burden of disease study, which estimates that in 2016, 3.74 million people in South Asia had dementia, including 2.93 million people from India. Okay, total population of 1.36 billion. At the time of 2016, 1.3 billion population. Among that, 2.93, nearly 3 million people had found with dementia. So in India, it is currently 3 million, but it may go higher and higher as the old age people, the number of old age population increases. So estimated dementia prevalence in individuals aged more than 65 years was, the prevalence was 7.5% in the normal rural public, with the study conducted at Vellore, and 10.6% in the urban sites such as Vellore, Chennai, city of Chennai, where 10.6% of the urban population is having prevalent or common to suffer or get exposed to the dementia. So in conclusion, the results of result discussed above, facts related to India and the Asia indicate that the prevalence of dementia in India can be 10.6% with variation across the different states. Okay, because the multi-language and the culture is different, practices are different in each state. So according to the states, the incidence or prevalence of dementia can differ very significantly, not almost near, but very distinguished figures can be identified. It is estimated that one of the statistics which tells that one of the pan-India study which was done to find out the prevalence of dementia. So it understood or it found that the coastal areas of the states which are in the coastal areas are having less prevalence rate of dementia as compared to the non-coastal areas or non-coastal states of India. So, and it is much more higher in the states like Jammu and Kashmir, okay, and Punjab. So there they are having high tendency or high chances of prevalence of dementia, okay, as compared to the coastal states like Andhra Pradesh, Tamil Nadu, Kerala, then Paschim Bengal. Okay, these are all the states which are having less prevalence of dementia according to that study. So, what is the main reason for causing the prevalence in India or that variation in the prevalence rate in India, which includes rapidly changing demography? Our demography is changing rapidly and shifting from the Indian culturally, traditionally developed Indian demography to the westernized or modernized demography, which is so called. So that rapid change or shift in the demography of country, which is increasing the chances of prevalence of dementia. Then disintegrating the joint family system because there is a lack of support system, and that loneliness which is making the individual to suffer with their activities and means that is affecting till the cognitive function of the each individual in the isolated family. Then malnutrition and low levels of literacy in women. Malnutrition is still present in some areas of the country where it is significantly affecting the development of the child, and it is leading to the early onset of dementia as well. Okay, the rural majority with rapid urbanization. Okay, now we can see all the trends of urban area are coming into the rural part, and or the rural population is shifting towards the urbanization, or rural area itself is urbanizing. So these are the reasons where it put forth the challenges in front of us to lead the lifestyle of the individual. Then low levels of literacy, multilingualism. Okay, the languages are many, so that is leading to the cause where the disparity in the individual. So individual who is migrating from one area, which is he is not able to comprehend the certain language in that state, so it leads to the lot of stress and which brings him into the crisis, and that leads to the many confusion, and like multilingualism is very much problematic, where the information also can't reach and the awareness cannot be created. This is another angle of prevalence rate in India, which are going to increase due to multilingualism. Then genetic diversity, which is our genetical composition is very different from all others within the country itself. So that genetic diversity or genetic makeup, which is some genetical compositions are more vulnerable for the destruction of the brain cells, whereas the other ones are more protected due to the inheritance or due to the cultural practices or due to the food habits. Okay, that all makes up our genetic composition, which we are inheriting from our forefathers. Then socioeconomic and cultural diversities, as it was discussed earlier. And then increasing burden of cardiovascular disease. As we know that the number one burdensome illness which is causing more expenditure is cardiovascular disease, and that cardiovascular disease itself is a reason for increase in the prevalence rate of dementia. So let's see the difference between normal aging and the dementia. As we saw that there are very evident changes. As I told you, memory loss or impairment in the memory is common in both the things, but the difference is in normal aging, the individual comes back to the recalling ability. Little difficulty, but he comes back. Okay, but in dementia, it is very difficult to elicit that to come back to the recalling capacity. He cannot recall. Okay, he totally the blank memory which can be seen in dementia. Whereas the other fact of old age is as the individual gets aged, still the intellectual capabilities are very finely present in the individual. He is very sharp to decide in the old age. I am saying he is very sharp to decide. He can judge the situation accurately. He can recall. He can memorize. All the cognitive functions are very much intact, but in dementia those cannot be seen. All the intellectual abilities or gross intellectual dysfunctioning can be seen in the dementia. And normal aging cannot means it won't interfere with the daily activities of daily living, whereas the dementia which involves. So there is high dependency in dementia when compared to the normal aging. In normal aging, the individual can be independent. Okay. Here in normal aging, you can see that memory loss related some typical identification which can be done. In order to say in normal aging, he is more concerned. Individual who is in old age and he is losing his memory, he is more worried about his loss of memory. But in dementia, memory loss will become more of concern to the close family members or family members of the person who is having dementia. So the loss of memory is not loss for the patient here in dementia, but it is a loss for the whole family. Please mute yourself. Somebody is unmute. Yeah. Okay. Thank you. Then, as I told you earlier, one may notice occasional difficulty with the finding right word that you want to use while you are speaking. But in person with dementia has considerable difficulty in finding or using the right word. Okay, so they are struck. They cannot proceed further, and their impression goes down. And they are looked means the other individual who are listening, they are looking at them as a dementic, or they are not fit for this or not worthy for this. So they lose their self-esteem and ego, and like broken ego leads to the anger and irritation and so on and so forth, and their total psychological functioning or psychological state of the mind gets disturbed. So peace is not present in them in dementia. Whereas in normal aging, it's okay. It means they forget, but they are not able to get the word, but they can. So also the part of aging process will be like the annoying problems of getting lost in the familiar place. You may have to get yourself a few moments to remember where you are, but you will come back. Means in normal aging, if person goes somewhere in the new area, he cannot recall how to go back, but he can gradually he can think and he can come back to his original place. Okay, but in dementia, it's not like that. So there is high tendency of wandering behavior where aimlessly they go somewhere and they are confused where to go back, how to go back to my place. Even in the familiar places also, they get lost themselves. Okay, as I'm going to project one video which you will be seeing the in video, action of the individual with dementia. There you will be witnessing that. And as one gets aged, the person still able to operate your common household appliances, machineries, equipments, electronic devices. In normal age, normal aging, it's okay. They can learn, okay, they can use, they can continue to use. But in dementia, you see there, they are very having hell of the time where they cannot operate such simple tasks also, simple new devices also, they cannot operate at their own. Okay, this is all about dementia and old age, okay, and the differences. Whereas focusing upon the Alzheimer's disease, I'm going to discuss in detail about the cause of Alzheimer's disease, which will be coming across in the further slides. Alzheimer's disease, now we understood that it's a cause of the dementia, okay, because the Alzheimer's disease, it is having bunch of changes in the brain cells, okay, and when it brings some behavioral changes, cognitive changes, cognitive function changes that interferes with the daily living, then it can be termed as dementia. So most of the cause, as I told you, 60 to 80% of Alzheimer's disease leads to dementia, okay, or otherwise the simple Alzheimer's disease can also be present, which is the destruction of the brain cells, which can be seen only, but no changes, no involvement of those changes, cognitive changes into their behavior. So that is just a pure Alzheimer's disease, okay. But most of the time, remember that Alzheimer's disease leads or gives way for the dementia. Even Alzheimer's disease is a progressive brain disease, okay. All of a sudden, as the as we see in the head injury leads to the injury to the neurons or cells of the brain. Such changes won't be seen in Alzheimer's disease. Alzheimer's disease is a progressive brain disease which slowly progresses, and those changes are much more evident. Initial phase, those cannot be identified, and the symptoms are also can sometimes be very mild or minimal level, which we cannot recognize it is Alzheimer's disease, okay. So Alzheimer's is a disease in which brain cell die progressively, one by one, slowly. Their volume of the neuron decrease, and once the volume has decreased, the functions also decrease. Once the function and volume are decreased, they tend to lose their energy. So once the neurons are not having proper adequate energy, then they shrinken and they die progressively, slowly. Okay, they don't die all of a sudden or overnight or some in a faster way, but they die in a progressive way. I mean, step by step, they weaken, and then they die one fine day. Okay, so like that, the total numbers of neurons which are present in million and trillion neurons which are in the brain, which they die one by one, one after another, and then to reach to the evidence of this death of neurons it takes very long time. That is around 10 to 15 years again to recall back. The condition is often regarded as a family disease due to the impact it has on the family. Okay, because this condition, Alzheimer's disease, also can be called as a family disease. It's a disease of the family because it brings much more dysregulation in the family, realignment of the family functioning. Okay, and that all it takes a huge stress upon the family. It brings huge stress upon the family, which leads to the disruption of the family functioning overall. So it's a family disease also, it can be termed as. It is very common among old age people, okay, but sometime, very rarely, it can be seen in the even in the young people. And most of the young people who are suffering with Alzheimer's disease are having a history or genetic history, or their family background is of Alzheimer's disease. So their father or forefather has this Alzheimer's disease. Sometime through the genetical endowment or the transfer of genetic material from the forefathers, that may bring some defects, and early age dementia, Alzheimer's disease also can be seen. So main affected areas in the brain are the area which is responsible for memory, attention, language, and problem solving. To name the few areas, like hippocampus, which is beginning phase, okay, and it covers further to the cortex, okay, frontal cortex, okay, and the upper portion where it in much of the gray matter is involved. Okay, there the areas of the brain which are like the cortex of the cerebellum, okay, and as well as the limbic system and all other areas it covers as the Alzheimer's disease turns from mild to the severe case. So let us focus in detail about Alzheimer's disease and the brain changes and what are the changes in the brain which actually takes place. So the one theory which proposes that there are some plaques. Plaque means the bunch of block which is created. Okay, that block and the tangle. Tangle means the neurons when they are elastic in nature, they are independently attaching with the next neuron independently. But due to the some changes in the brain which makes the tangles or two neurons come together and they form a complex in their nature, and that tangle which makes the hallmark of Alzheimer's disease. Okay. So what happens there, how the plaques and tangles are formed, that is by beta amyloid plaques. These plaques are made up of certain protein, okay, which is broken down from the amyloids. Amyloids are broken down and they form a beta amyloid plaques, which are dense deposition of protein and cellular material, which is a waste material of the neurons, which they comes together and that accumulate outside and around the nerve cells. Okay, for that also I'm going to show you the video, there you will understand. Then once these amyloid plaques are formed, then the neurofibrillary tangles are also seen, which are twisted fibers that build up outside the nerve cells. You can see here how the process of beta amyloid plaque formation occurs. Amyloid precursor protein, okay, that is main precursor or fundamental part for formation of amyloid plaques. Okay, so amyloid precursor protein sticks through the neuronal membrane, the lumen or the membrane of the neuron, which accumulates the APP, that is amyloid precursor protein. Okay, and enzymes cut the APP into fragments of protein, including beta amyloid. So the beta amyloids are cut down and they are separated within the brain cell from the neuron, and that beta amyloid, they come together and they form the plaque, which you can all see here. See, this is a healthy neuron which is shown projected here. Okay, and these are the microtubules which are present within the neuron and the dendrites. Okay, so within that microtubules, these microtubules get disturbance in case which you can see here. This one microtubule which is shown for you, where the tangles are occurring, neurofibrillary tangles which can be seen. Okay, and this is neuron. This disintegrating of microtubules which leads to the breakdown. Okay, and the tangles are broken down. Okay, and the tangle leads to the breaking down of the proteins, and that accumulates in an abnormal way, that is called as plaques. So overall, if yes, someone is unmute, Ria, please mute yourself. So that overall, if we have to see the changes in the brain, this is a healthy brain. This is a size of the healthy brain which accumulates within the head or within the skull. Okay, where the landmark which are shown, these are the brain size of the dementic or Alzheimer's type of dementia patient, where the shrinking of the brain which takes place. Okay, and the relative picture which is shown in front here is dying neurons with tangles. Okay, they see this is normal neuron, healthy neuron which is shown here. Okay, and you can see the dying neuron, how it is changed into its size and shape and volume. So these are the plaques which are released outside the neuron by this abnormal neuron. Okay, the tangled neuron. So this is how the progesterone emission test looks like in the normal brain. Okay, which the normal functioning which is occurring, but here the blue increase in the blue areas which suggestive of the Alzheimer's disease. So if we have to see the stages of Alzheimer's disease, okay, which includes preclinical means before the symptom occur and it is evident clinically. So before the patient is brought into the clinical, what are the symptoms which can be seen, which are underdiagnosed, which are thought to be normal, Okay, but they are Alzheimer's type of changes which are seen. That is preclinical. Then mild to moderate. In mild and moderate, what are the signs? And in severe, what are the signs which we can show, which we can see in the further slide. So this one area which is projecting about preclinical Alzheimer's disease, in which the preclinical Alzheimer's disease, which can show signs of Alzheimer's disease are first noticed in the entorhinal cortex of the brain, okay, which in the normally present in the hippocampus, area of the hippocampus, which you can see here. Okay, these are the two sections of hippocampus, left and right, where the hippocampus starts affecting first. Okay, this blue shade you can see here. Okay, that blue shade is nothing but the hippocampus is involved here first. Okay, the affected regions begin to shrink. So this area starts shrinking. Okay, as well as the nerve cells start dying there at that hippocampus region. So first part of the brain which is affecting in case of Alzheimer's disease, in the preclinical Alzheimer's disease, which can be seen is hippocampus, changes in the hippocampus. So when there are changes in the hippocampus, the first thing which is noticed is sign of memory loss. And memory loss is such a nature, the nature of memory loss is like they are not able to recall at all. Okay, but normal changes in the old age, the memory loss is some type where they take some time to recall. Okay, but in preclinical Alzheimer's disease, memory loss, the characteristic of memory loss is the individual cannot recall back anything. Okay, he cannot recall or remember, or he rejects, he denies. Okay, at his consciousness or at his perception, he says that nothing like that. Okay, he totally denies the problem. Okay, then mild to moderate Alzheimer's disease, then the progression of this disruption or shrinking of the brain progresses towards right from the hippocampus towards the cortex. This is a cortex. Okay, so the cerebral cortex, cerebral area or the brain cerebral cortex starts involving itself in shrinking process. Okay, and there the neurons starts stopping to work. They stop working gradually. Okay, and even at fine day they die also. So the area of the cerebral cortex also can be seen in the mild case of Alzheimer's disease. So mild Alzheimer's disease signs can include, along with the memory loss, the confusion also start developing. Okay, trouble handling means money. They cannot deal with the money. Simple transaction of the money also they find difficult. Then they draw the poor judgment. They involve into risky behavior by judging wrongly. Okay, one of the poor judgment implication is like contracting with the COVID-19, because their judgment is poor. They don't realize why they should wash hand and why they should apply sanitizer when they are exposed or they thought to be exposed. So their judgment of thinking of exposing to the COVID-19 is poor. Then ultimately they don't realize the washing of hand also. So poor judgment leads to the problematic behavior, and the deadliest disease also or the illness can also accompany them. Then mood changes and increased anxiety or the fear, which are evident in the mild Alzheimer's disease. Moderately increased memory loss, okay, and confusion, which are impaired in mild, they get worsened at their high. Okay, problems recognizing the people, they cannot recognize their familiar individual also, even family members also. Okay, difficulty with language and thought. Okay, what the thought process is not working normally, then ultimately it can be reflected in terms of disruption in the speech also, that is language also. Language is a skill of the individual which can also be lost in this Alzheimer's disease. Even the restlessness, agitation, wandering behavior, repetitive statements, they repeat the same thing again and again. So such statements of assurance are more commonly seen in this Alzheimer's type of dementia. And with this agitation and restlessness, sometimes they injure themselves. Okay, they just scratch their skin so intensely that they may see with the injuries on the face and the extremities and the body, all over the body. So sometimes they come to the hospital with that reason of injury to self. But when the history taken by the medical authorities at the casualty or at the hospital, they tend to understand this is something typical nature of restlessness and agitation in case of Alzheimer's disease. So that is, see, when the Alzheimer's disease is clinically brought into the picture, that is when it is mild to moderate. At some time, mild may merge into the society and may not be recognized. But at some time, mild case to moderate Alzheimer's disease, they are brought into the clinical attention. But otherwise, they are not. Then at severe Alzheimer's disease, here there is extreme shrinkage of the brain which takes place, and most of the part of the cerebral cortex is shrunken and involved. You can see rightly here in the sectional picture of the brain, which is shown like sagittal section, which evidence that this is shrinking up and extension of the spaces within the brain. This lateral ventricles are space is increased. Okay, all the lumens which are present in the brain, which gets increased in its size. Okay, that shrinking, severe damage to the brain and shrinking of the brain leads to the symptoms such as weight loss, which can be seen in the individual, seizures, skin infection, okay, groaning, moaning, okay, or they are just grunting and they are expressing certain voices which are very unnatural or which are not expected, or grunting also can be seen in the voice, increased sleeping, okay, loss of bladder and bowel control too. Okay, their urinary incontinence, bowel incontinence can be seen. Okay, and then means once the individual develops Alzheimer's disease, within span of 14 years, the individual dies. Okay, that it progresses from starting to the severe form of dementia or the Alzheimer's type dementia, and there the death may occur. So premature death is also associated, but the lifespan of that 10 to 15 years of survival after developing Alzheimer's disease is very much troubling to the individual as well as to the family at large. Okay, and it is very expensive also. And most of the deaths, like 70% of the deaths in severe Alzheimer's disease are seen with the aspiration pneumonia, aspiration related pneumonia, which are seen. Caregivers can turn to the old age homes or hospice for help and palliative care. Okay, then all in all, old age is commonly associated with loss of cognitive abilities, and when these symptoms worsen and they interfere with the daily activities, then they are diagnosed with dementia. As to summarize, Alzheimer's caused by deposits of plaque and tangles around brain cells and is most common cause of onset of dementia. So how these Alzheimer's disease can be diagnosed? With the help of detailed history, okay, in their especially in the cognitive domains of their functioning. Okay, then mini mental status examination, which can give the fair idea about their memory, intelligence, fund of knowledge, judgment. Okay, then general knowledge of problem solving ability, attention, okay, concentration, counting, forward, reversing, and addition, subtraction, language test. Okay, all these includes in the mini mental status examination, which mainly focuses upon the cognitive measurement. Okay, there are certain advancements in today's diagnosis of Alzheimer's disease, which is blood biomarkers. Like blood test also can tell about the early onset of Alzheimer's disease. That is through these plaques. Okay, that is called as the one form of plaques which include is tau, which is called as tau. Okay, tau 181 recognition in the blood can help to diagnose Alzheimer's disease. The tau, which is found most commonly in the plaques which are formed, okay, amyloid plaques. That amyloid plaques discharges or gives out the tau in the blood, and the blood normally doesn't show the tau, but presence of tau 181 in the blood can suggest there is presence of Alzheimer's disease. And common diagnosis tools which are used are CT scan, MRI, and PET. Then what is the difference between Alzheimer's disease and dementia? As now you all are clear, I think it's very much clear for all of you to differentiate this. Okay, so all dementias are not Alzheimer's, but all Alzheimer's are dementias. That is the difference in one word I can conclude with. So management, the main goal of management, either nursing or medical management or psychiatric management, which focuses on 4 goals, which are to slow the progress of the disease. One thing we can do, because there is no of the sure treatment which can cure the Alzheimer's disease. Mind you that there is no proper treatment to cure, but it can manage the condition. So slow progression of the disease can be done through the medication and through the intervention, psychosocial interventions, and then manage the behavior problem, confusion and agitation through psychopharmacological drugs and behavioral modification through the psychological interventions. Then change the home environment to be safe by maintaining the environment surrounding of the person safe. Okay, and then support to the family members and the caregivers. That is also very important to see that the dementia or Alzheimer's type dementia patients are getting the family care and the caregivers are continuing to care the patient. Okay, in that case, caregivers also need a training and education. So there are certain lifestyle changes the individual has to take into their life as they are identified as a old age person or probably to have Alzheimer's disease. Then they have to have certain physical vigorous, the regular physical exercise. Okay, they can have a light therapy. Okay, they can listen to the music. They can have or rear the pets. They can involve in gardening. They can have relaxation training. Okay, then they can have a safe return program where identification or bracelet or the ID which has to be placed into their pocket or bracelet can be fixed by stating that the person is having Alzheimer's disease. So these lifestyle changes can be made in the individual to make it sure the person is handled properly or adequately. So there are some dietary supplementations which can help the individual to get the medical, that is also called as medical foods, which can strengthen the brain activity or formation that can prevent the formation of plaques and weakening of the neurons. Okay, such as most commonly useful are omega-3 fatty acids. Okay, then vitamins, vitamin B6 especially, and B12. B12 is a very important aspect, and zinc. Most commonly in old age people, the zinc is reduced drastically. So the level of zinc can be uplifted in the body by supplementing 3 to 50 mg per day. Okay, and then certain acupuncture therapies, mind body medicine, that is music therapy can be involved, massage therapy can help. Then another hallmark of use of treatment is reminiscence therapy, where in which the individual is made to recall his happy time, happy past. Okay, that in terms of photo album. Okay, then school records or certificates of him, okay, or her, then medals and awards which he has achieved in his lifetime, then work identity or salary slip which he has earned throughout his life, that can be shown to him. Then other relevant information such as paper clippings can be kept, okay, of his past time. Means in his past life, whatever has things have happened, good things that are brought into his current consciousness. So that also helps in reducing the effect or impact of Alzheimer's disease upon the behavior. Then the reality orientation by preparing a whiteboard and writing the assignment or daily activities, using the calendar method, writing on the forthcoming task are written on the calendar on that date, specific date, labeling the rooms, okay, so that he can identify and recognize the which room he wants or has to go. Okay, reading newspaper daily so that he can keep in touch with the abreast with the social current affairs or social happening. Okay, visiting the local shops or going out. It means that he has to continuously keep his brain working, apply his brain or mind upon the task which is in hand. Okay, he has to work on it. Then the treatment modalities which are available are the specific medications which are used most commonly are donepezil and rivastigmine. These both are cholinesterase inhibitors which are prescribed to treat the symptoms of mild, moderate, and severe, all three forms of Alzheimer's disease. Okay, what they do is they prevent the breakdown of acetylcholine. As I told you, acetylcholine breakdown brings in the impairment in the behavior and psychomotor activities. So acetylcholine are much more essential for the brain or to function and to bring the changes or to function properly in terms of psychomotor activities, agitation, restlessness, confusion. They are the end products of decreased acetylcholine in the brain. Okay, acetylcholine, the prevention of breakdown can be done with the donepezil and rivastigmine. Okay, there is other one is aducanumab. That is very important medication which is recently discovered, which removes the abnormal beta amyloid. beta amyloid plaques, which are abnormal in nature, are excreted out of the body. Okay, and that helps to reduce the number of plaques in the brain. So number of plaques are less, so the space available for the neurons is adequate, because the plaques increase in the plaques, that pushes the nerve cells again to constrict or shrink down. Okay, so when the plaques are reduced, then that is the other neurons which are getting disturbed with the extra space which is accumulated by these plaques, and they're pushing to shrink or to adjust themselves and to fit in, that can be minimized. So this is modifying immunotherapy. It is called as like disease modifying immunotherapy, which is prescribed to treat the mild cognitive impairment or mild Alzheimer's. So this can be initiated at the beginning when the individual start showing the mild preclinical Alzheimer's disease. When he has been brought into the diagnosed and brought into the clinical attention, he can start with this aducanumab medication so that he can prevent or further damage. Then memantine is another N-methyl D-aspartate, that is NMDA antagonist, which works against the NMDA memantine, that blocks the toxic effect associated with excess glutamate. Increase in the glutamate, and that can help to regulate the glutamate, or which the dysregulation of glutamate which has taken place in the within the brain, that memantine can correct it. Okay. So these are few important medication which can be used. Then preventive care, which almost includes, there is no as such the preventive care. If it has to occur, it will occur itself. Okay, it can't be preserved, but still, as an advancement, what we can do a preventive care we can take is, we should have eating a healthy diet when young or older adult, or middle or older adult, the individual should have healthy diet, exercising regularly, eating more fatty foods. Okay, cold water fish, what it is called as cold water fish, can be increased so that the omega-3 fatty acids are rich in them. Okay, eating fish at least 2 to 3 times per week provides a healthy amount of omega-3 fatty acids. So more the fatty acids, healthy fatty acids, more the healthy the brain is. Then other things like vitamin A, E, C, that is antioxidants. They are called as antioxidants. They are found in dark colored fruits, which are and vegetables which are dark in color. They are rich in them, so that should be consumed at high amount or regular intervals. Okay, maintaining normal blood pressure. Okay, because to reduce the vascular related dementia or Alzheimer's disease. Then certain medications may prevent Alzheimer's, including statin drugs, that is pravastatin or lovastatin, which is used to lower the cholesterol. So by minimizing the minimizing the cholesterol, minimizing the cardiac related problems. So minimal cardiac problems, healthy is the brain. Okay. Then keeping mentally and socially active, that is very important. Okay, the secret of preventing the age related changes, also aging related changes in the brain, can be prevented by keeping mentally active, remaining mentally active in the society. Okay, applying brain upon or mind upon the activities, which can be a remedial measure, as far as my knowledge is concerned. Like the mind should be active enough. Okay, ideally the retirement age is 60 years, which is decided because they cannot keep up with the ongoing activities. Okay, and but the sad part of that retirement life is they become mentally ideal. That should not be the case. Every person who is retiring from their occupation or from their job, routine job, they should find some way to occupy their mind in a fullest level. Okay, there should not be any relaxation given to the activity of the mind. Mind has to be active all the time in one or other task after the retirement also. So there are certain clinical trials, research and development activities which are taking place in order to early diagnosis, and maybe in coming days, if we can get some definitive treatment to treat the Alzheimer's disease, that is also possible. But still the scientists and the medical scientists are working upon it, and many researches worldwide or parts of the world are going on. Okay, and hope we will come out with certain definitive treatment management. Now, what is our role in this? See, our role is to create the mass awareness about all the information which we could learn today. That has to be made aware to the public. Okay, and we have to frame some advancement or activities wherever we are for the people who are above 55 years age. Some activities which keeps them engaged and they can follow it in their lifetime, that we can train them. Okay, some training activities or creating awareness through health education by at the grassroots level, going into the community house visit, or at the mass level also the awareness can be created. So there are certain tips for you all to how to deal with the patient having dementia, Alzheimer's type dementia or dementia. See, we have to approach through these 10 tips. Okay, those are like proper eye-to-eye contact has to be maintained when you are talking to the patient, so that he can sustain his concentration and attention upon your words. Otherwise, he gets distracted because of his dysregulation in the concentration and attention. Okay, speak calmly, speak slowly, don't so rapid in your speech. Okay, speak calmly so that they can understand, they can focus their attention, whatever they have at the minimum. Speak in short sentence, don't elaborate too much. Okay, only ask one question at a time. Don't say remember this. When we force remember, they tend to challenge themselves and they tend to forget because they're fearful, they are disturbed with their remembering skill. Turn negative into positives. Don't project their negative part of their behavior. Try to convert it into positive way and convey that. Don't argue with the patient. Okay, body language is very important. Pay attention to your own body language when you are interacting with the patient with Alzheimer's type dementia. So there are certain recommendations which I want to put forth amid this gathering. Okay, make dementia a national priority. This is very important. We do not recognize, but as I told you, especially our country is going to face a real challenge in future coming years, because the old age population is going to be drastically increased. Magnitude of old age population will be high in coming days. So we have to prioritize this problem as a national priority now, and start think tanks should start working upon developing certain strategies to minimize, and the scientific work or the research and development work in this area has to be strengthened. The ICMR has to come forward in the identification and framing the treatment, definitive treatment for dementia. That is through increase in the funding of dementia related researches. Okay, awareness has to be created in the population or the public. Improve dementia identification and care skills. Develop community support. That is very essential in order to create an impact of this Alzheimer's disease and dementia upon the community. So community support has to be sought. The community also has to involve in the care and treatment, diagnosis, care and treatment. Develop curriculum related to dementia nursing. Now, I urge that if there are any stakeholders of nursing education who are here, they can take up this priority of framing some specialized training for nurses in care of patient with dementia. Then develop new national policies and legislations for people living with dementia can be framed. They are at minimal, they are not beneficial directly to the dementia or Alzheimer's type individual. Okay, so some alteration changes in the policies and legislations can be made through the Mental Health Act. Okay, to get advantage or benefit of that to the people who are most needed. So these are the few references which I made to bring all this content in front of you through some of the research studies, which and some textbooks. Okay, and I believe that the take-home message for all of you for today's webinar is always believe that the struggle you are in today is developing the strength you in tomorrow. So we have to struggle today, and we have to work hard to identify sensitize the dementia topic, and we have to come out with some strong strength, that is a definitive treatment and proper nursing care to the patient with Alzheimer's disease. I hope you all will take what I mean or the zeal with what I'm saying to you all. Please carry it with you and try to inculcate or illustrate into your professional practice. So here I come to an end of my speech or the guest lecture. And thank you very much for all the cooperation and the attention which is provided by the participants and the organizers. Thank you so much. And if there are any questions, I'm open to answer those. Please. Thank you so much.
Thank you, sir. It looks like we have some questions.
Yes, yes.
Sir, how long does the Alzheimer's disease take to develop before we see warning signs?
Yeah. So see, as I told you, like it gradually and progressively goes on developing in the individual. Okay, so it takes hardly like to reach to the preclinical Alzheimer's disease. From there to develop mild to moderate, it takes around 5 to 6 years. Okay, and at the 15 years, it can reach up to severe Alzheimer's disease also. And it also depends upon the individual's body makeup, genetical minds made up, all that factors also influence upon developing. But as a whole, as a sole Alzheimer's disease, if it has to go to the severe level or to identify the Alzheimer's disease, it takes around 10 to 15 years. Thank you.
Sir, how long do people with Alzheimer's disease live after developing the disease?
Yeah, that is 14 years, as I mentioned in my presentation also. Like around 14, max up to 20 years, or even within the 8 year or 5 to 8 years also, they may die with some or other complications, or if they have any other like any other illnesses, chronic illnesses. So all that contributes, and like as we saw COVID-19 and Alzheimer's disease, it's very much closer. You understand the situation, like how Alzheimer's disease patients are having susceptibility towards the development of COVID-19. So like that, Alzheimer's disease may put the individual at risk of some or other complications, and that may end up into death.
Thank you, sir.
Yeah.
Yes, sir. As of now, so much was the questions.
Yeah.
Okay. Now I would like to call upon our dear principal, sir, to address the gathering.
Hello,
Yeah, good afternoon, everyone. Especially Dr. Bahubali, it was an excellent presentation where you have taken your time in preparing well and delivering the content in detail to the participants. And most of the participants were BSc nursing and some MSc nursing psychiatry students were there. And this presentation would have been very useful for them, not only to know about the condition of dementia and Alzheimer, also they will be got enough awareness on the Alzheimer's Day, and they can go back to their clinical area or respective area to give their nursing care in more detailed way. And on behalf of Sarvodaya group of nursing institutions, our heartfelt wishes to Dr. Bahubali, and the wishes are there from our chairman Sri V. Narayan Swami, and also the directors Mr. Sunoj and Mr. George has conveyed their wishes to our special guest of the day. And also on behalf of all the staff, we convey you our heartfelt thanks for accepting it at an earlier time before Alzheimer's disease only. This is Awareness Day. And also it was very, very effective and very useful. And thanks a lot, Dr. Bahubali. And we used to request you to have a continuous coordination with us for our future programs also. Thank you, Dr. Bahubali.
Thank you, sir. Thank you. And I'll be in touch with the institute for any other activities. I am very much open to your institute, sir.
Yes. And any more questions are coming, I will ask them to post to your mail ID. And
Yeah,
also
sure.
I thank Mr. Anand and Mr. Joshi, who is not able to join here physically, for arranging this wonderful webinar, and all our IT people, Mr. Darshan and Mr. Dinesh, and also all our HODs, all our faculty, and especially all the participants, mainly the students who have registered and who have attended this webinar to utilize and update their knowledge on Alzheimer's. Thank you all. Thank you very much.
Yes, sir. So can we take one group photo or a screenshot?
You have to slideshow. You have to stop.
Yeah, I'll do that.
And I request all the participants to switch on their video, but unmute.
All the participants, kindly switch on your video.
Yeah, you can take a screenshot. Anand, can you take a screenshot in this? Yeah, all can switch on your video and you can switch off your audio. Yes. Ready? Still more people can join. Videos are off.
Yeah, I think recording of this can be found in the YouTube, right? Anand?
We can, sir.
Yes, thank you.
It is on YouTube. Thank you, sir.
Yeah, sir, at the outset, once again, thank you so much for all the cooperation and giving me this wonderful opportunity to interact with all the participants. And I would like to thank each one of the administrative authority of Sarvodaya College of Nursing, dear Dr. Dinesh Selvam sir, Raghavendra Joshi sir, and all the faculties of the college. Indeed, it was my pleasure to be here for 2 hours with you all. Thank you so much from my side. Thank you.
Thank you. Thank you, doctor. Thank you.
Yes, sir.
Thank you, sir.
Thank you all.
Thank you,
Again,
sir.
we will meet one another webinar. Soon. Thank you all. Thank you all. Bye.